Let's return now to Whangaparāoa, where two people who were evacuated from Wuhan could have the whole camp to themselves after one displayed symptoms of coronavirus. 8 more people will arrive there from the Diamond Princess cruise ship later tomorrow. It comes after it was revealed 16 New Zealanders from Holland America's MS Westerdam were allowed to disembark the ship in Cambodia at the weekend, just hours after an elderly passenger tested positive for COVID-19. Those passengers, including a family of 5, were allowed to fly home to New Zealand, where they have now placed themselves in self-isolation for 14 days. We had invited the Director General of Health, Ashley Bloomfield, on the programme tonight. He declined, as did the Director of Public Health, Caroline McElnay. But joining us now, live from our gallery studio, is Health Minister David Clark. Good evening, Minister.
Good evening, Lisa.
Can you bring us up to date? The 2 people that have been left at the Whangaparāoa site, are the results back? What can you tell us of that?
Lisa, I've just literally got off the phone with the news that those people have been tested and the tests have come back negative. So that's really good news. They, of course, didn't really meet the threshold for a suspected case, but you'll understand that we've been taking a very cautious approach, and so a test was carried out for each of them, and they've both been declared free of any virus.
So they're free to leave the site now?
They're free to leave the site, so that they'll be, I think, relieved and looking forward to being reunited with friends and family.
OK, so the other big issue is the Diamond Princess. We are expecting evacuees from there. How are they? Can you just clarify the logistics? How are they getting back, specifically from Darwin? What flight?
So my understanding is that there'll be a commercial flight which will come back and is likely to land tomorrow evening.
What do you mean a commercial flight? Like, are they going to be on a plane with other passengers or on their own?
No, sorry, a chartered flight with a commercial provider.
OK, so who's going to be the provider this time round?
Look, I don't have those details, Lisa. This is something that's been a developing situation, but there are now plans in place.
So have you confirmed a carrier who is prepared to take them? You just don't know who that company is?
That's my understanding, yes.
Is it not Air New Zealand?
Look, I honestly, Lisa, I don't know the answer to that question.
Have you been briefed by Ministry of Health on this?
It's obviously an MFAT responsibility, so it's not directly my thing, but they've kept me in the loop with the planning and assured me that it's all on track.
What have they told you about how those people will be transported? Are various passengers being kept separate from others? Are they all on the plane together, freely mingling, or what?
I'm expecting they'll be taking the same kinds of precautions that they took with the flight from Wuhan that we had come back. They'll be taking public health approach to this. There'll be appropriate hygiene recommendations. They'll be no doubt supplied with masks and there's a St John's accompaniment. So all of the necessary steps you would expect are being taken. We want to protect those people as well as family, friends, and of course those staff working on the airline to take them home.
And what has the Ministry told you about their potential exposure, these passengers, cruise passengers, their potential exposure, given what we know about infection rates on the Diamond Princess?
Yeah, well, I think that's the key point, Lisa. We do know that the infection rates on the Diamond Princess are higher than they are across broader China. So we're taking the situation there incredibly seriously and making sure that these people are given the right information and, of course, are being brought back to a quarantine site at Whangaparāoa.
So I'm sure they've done some numbers and looked at the situation. What have they told you around expectations of infection rates? Have they told you whether it's likely or not we will end up with our first case from these passengers?
Well, the reality is that, of course, people are not allowed to board the plane if they're showing any symptoms. So that's the first test that gets met in these situations. So there's a low likelihood, really, of any of them being infected. But, of course, as we have all along the way, we're taking a very cautious approach, looking at the wider public health and safety of New Zealand and of our community here.
But even if they show no symptoms getting onto the plane, that's not really a reassurance, is it? Because some of these passengers have been mixing with other passengers right up to the day that you bring them home.
Look, my understanding is that on the boat they have been trying to operate a quarantine situation. Obviously that hasn't been as effective as they had expected, and that's why we're treating this situation incredibly carefully and making sure that they have all the information they need, but also that the flight staff are taking appropriate protective measures as well. Let's not lose sight of the fact that this is a developing situation. That's why we're being cautious. Equally, we know that the infection rates are nothing like some of the more infectious diseases we're familiar with. If people take public health precautions like good hand hygiene, cough hygiene, and so on, the things that public health staff are advising, there is a low chance of wider infection if anybody indeed does have any infection at all.
Can you clear one thing up for us? Is it voluntary to go to Whangaparāoa? Do they have to go there?
The people boarding have signed an agreement, as I understand it, or they've reached an agreement that they will go there.
So have they signed paperwork? Have they signed paperwork,
They would not
Minister?
be allowed back in the country if they were not going to Whangaparāoa. There's a medical order, effectively, that empowers the medical officer of health to quarantine these people.
But have they signed something?
I don't have the detail on that, but I can tell you that the medical officer of health has the powers to quarantine them.
How long do you reckon it is before we're out of the clear here?
That is something that nobody yet knows. We're following the science on this and the health advice. Of course, we're taking a public health approach to this, and we're watching all of the developments as they come about. I want to say thank you, though, Lisa, to everybody who's in self-isolation. Actually, New Zealanders and people around the world don't want their family or friends to get infected, so people generally, in fact routinely, and public health data will show this, do follow the guidelines as long as they've given opportunity to understand what they are. People do take those things seriously, and so I want to thank New Zealanders who are participating in self-isolation for their efforts, because the community is grateful. There has been no case here, but that doesn't mean we shouldn't all take a cautious approach.
Appreciate you joining us this evening. That is the Health Minister, David Clark.